I'm Burton Goldberg, and I want to tell you why this film is so important. We're going to show you a blood test that is only done in Germany that will tell you what chemo or natural substance will work on your tumor, because chemo only works 20% of the time. 80% fails, and of the 80%, 60% does harm.
That test is what ascertained that I needed an ovarian cancer chemo. I understand that in this country, a doctor can't give a prostate patient an ovarian cancer chemo. It's against the rules. You have to follow the cookbook, so to speak, and that's part of why we don't have the success.
We'll show you a hospital in Germany that uses iron oxide into the tumor and burns out only the cancer, whether it's brain or liver or kidney or prostate.
We would expect 3 months survival with those patients, and most of our patients are still alive.
We're going to show you a surgeon in Frankfurt who does abulation. He puts a catheter into your organ and puts chemo right into that organ, ties it off for about 5 hours, and then drops the chemo so it doesn't do harm to the whole body.
What you saw today is to insert a catheter in any type of vessel you can imagine. We insert ports for cerebral tumors, for lung tumors, for rectal tumors, for pelvic tumors.
We're going to talk about the causes of cancer. Our doctors know what causes cancer.
Chemicals, genetic, environment, dietary, all of those things.
Part of it is genetic, part of it is environmental, part of it is what we are eating or what we are exposed to.
We're going to talk about the need for CAT scans and how biopsies can be very harmful.
The tumor is here, you can make a biopsy, you go through the tumor and cut
you miss it.
You miss it, but you open it.
Even end-stage cancers are reversible using integrative medicine, the best of both worlds. If you have cancer, this film is important. It's highly dense in information, and you'll have to see it several times. It's 2 hours long, so if you or anyone you know have cancer, this film can be a lifesaver.
I made it here just in time.
Thank God.
And so they reversed it with a lot of their treatments. They did thermia for one go-around.
Full body?
Full body.
With some low-dose chemotherapy?
But it was a bumpy month, but it was just a month. And I'm back alive and kicking again within a month.
This is astounding.
Yeah, the white cells were non-measurable. And then they did immune system building, and they went from below 500 to up to into the 30,000, back down into the normal range.
And they saved your life.
I believe so.
I've called this program, Curing Cancer, the best of both worlds. For not one system alone is as effective as using the best of conventional medicine and alternative.
Getting better every day. They saved my life.
I almost think it equates to murder, the way some of the patients are left go. I experience it with my own dad, I experience it with my brother's wife, and many family members. When you become fourth stage terminal cancer, it seems like they give such excesses of chemo and radiation that alone is enough to kill you. Very few people survive.
And I said at that point, you must take everything, and the university must give this other chemo. And indeed they did, and the lung metastases disappeared and the tumors disappeared.
So when you have the chemo here,
yes,
it's done differently.
Very differently, very special to my cells. For example, they check my sensibility for the chemical things they want to give me, because each body is reacting different.
She began to feel better, and she said, I saved her life, which is really, it's, I'm absolutely delighted. I feel like a guardian angel. It worked, it worked beautifully, and all of the 30 metastases are gone.
I always said when I didn't had Dr. König, I didn't live.
In Frankfurt, Dr. Vogel, an oncologist, radiologist, and surgeon, who we'll see is inserting a catheter directly into the diseased organ for the application of localized chemotherapy.
For this interventional vascular oncology, we are performing two types of procedures. What you saw today is to insert a catheter in any type of vessel. You can imagine we insert ports for cerebral tumors, for lung tumors, for rectal tumors, for pelvic tumors. This is one step. So we are inserting the catheter there, and then we have the port. But our local chemotherapy, we are most in favor to combine it with hypothermia. And this is a big project we do together with Dr. Scheller also.
The reason we do whole body hypothermia, also local body, in this case whole body hypothermia, is to enhance the effect of any kind of chemotherapy.
We follow by genes the drug pathways within a cell and detect by that approach whether a drug would work or has worked or not, or whether you have resistance factors. Disseminated cancer cells have a different make-up of genes than the clinical tumor would have.
So the tumor and the living cells that slough off the tumor need different treatments.
People whose disseminated cancer cells are either inactivated or even better removed from the bloodstream live longer.
On this way, we have 74 patients in the last 8 years. No surgeon would like to operate them because the tumor is too large. Then he helps me to have a shrinking. Then we perform the operation, and after that we send the patient to him back. And all the prognosis from all these patients was they will die in 3 weeks till 6 months. But 58 of them are still alive.
The first aim for this medicament is reducing the pain which is connected to this bone metastasis. The second aim is also to reduce the progress of these tumors in bones.
He develops bronchial cancer on his left side. We know that already. The X-ray and CT and PET scan didn't show anything. But we know, and the patient knows, that he is going downhill. He had several pneumonias, but the left side here, it is originating here in the jaw dental area and is going all the way down. It is not on the right side. It is on the left side. That's a very important finding, and we have to do something about this.
Dr. Rao in Switzerland says that 95% of all breast cancer patients have a dental involvement.
I can agree 100%. He's quite right. We found the same situation, and we even found several teeth that are characteristic for the breast cancer.
Conventional medicine doesn't know about it because they're not taught. And one thing for sure, people want to stay blind for their image, just they want to flow in the mainstream medicine.
We would expect 3 months survival with those patients, and most of our patients are still alive.
People whose disseminated cancer cells are either inactivated or even better removed from the bloodstream live longer.